The management of resistant chronic phase CML is pretty more complicated because we have more options today. Probably 5 years ago we just had Ponatinib for those very resistant patients, and the vascular toxicity was very, very challenging. Now with the findings from the OPTIC study, which show us how to safely, or more safely use Ponatinib, and the findings from the ASCEMBL study, which show us that Asciminib monotherapy can be a really promising agent in this setting, we have two very, very good options. It's sometimes hard to choose which is the better option, Ponatinib or Asciminib, but we tend to prefer Ponatinib for the highly resistant patient who doesn't have a significant cardiovascular risk profile, and we tend to prefer Asciminib for those patients with more low-level resistance, and particularly those patients with a good, with a high cardiovascular risk profile, where we wouldn't like to use Ponatinib, even with the modified dosing that we've seen in the OPTIC study. So it's more complicated because we have more options, but that also is better for our patients.